Assalamu alaikum. Welcome to our seminar. It's about hyperemia and congestion. This seminar is presented by me, Ghasaq Asad, and my colleagues Farah Ali and Reem Hussein. Thanks for Dr. Khalid Wissam and Dr. Ilaf Abdul Wahab. Here we have the objectives and the distribution of the tasks for the seminar. So the start will be with Farah. She will give an introduction and then explain the active hyperemia, its causes and effects. In the second part, Reem will explain the congestion, causes and types. She will also talk about effects of venous congestion. Lastly, in the third part, I'll give two examples about chronic venous congestion. In the next slide, Farah will give her introduction for our seminar.
Hyperemia and congestion refer to an increase in the volume of blood within the vessels of an organ or tissue. But what do we mean by hyperemia? And what is the difference between the active hyperemia and the passive hyperemia? What are the types and effects of each one? To see all that, please give me your attention. I am Farah Ali and I will explain to you the active hyperemia. First, the difference between active and passive hyperemia. An increase in blood volume within arteries or arterioles that is increased in flow. It refers to as active hyperemia or hyperemia. While impaired venous drainage that's diminished outflow is called venous congestion or passive hyperemia. As we just mentioned, hyperemia refers to an increase in blood volume within a tissue or organ. It's an active process resulting from arteriolar dilation and increased blood inflow. The dilation of arteries, arterioles, and capillaries is affected either through sympathetic neurogenic mechanism or via the release of vasoactive substances. Hyperemia can change the tissue in the affected area, produce warmth and redness, bright red in color, because of engorgement with the oxygenated blood. Hyperemia could be of physiological or pathological cause. Physiological cause of hyperemia. It develops in organs and tissues due to increased metabolic activity of tissues. This caused a local stimulus for vasodilation and increased blood inflow, as in skeletal muscle during exercise. Pathological cause of hyperemia. Hyperemia is part of acute inflammation, is one of the first vascular changes in acute inflammation, mediated by inflammatory mediators such as histamine and many others that stimulate vasodilation and increase blood inflow, resulting in hyperemia. That all was about active hyperemia. Now, my colleagues will continue.
Our blood vessels transport about 7,000 liters of blood every day. The veins move the blood, which is composed of cellular waste and carbon dioxide, from the various organs of the body toward the heart. You see what happens when the veins blocked for any reason. The affected area will experience congestion. So, what's congestion? I am Reem Hussein. I will talk about congestion. Congestion. Excessive fluid in tissues, vessels, or both. It's a passive process due to dilation of veins as a result of partial obstruction to the venous return. This will cause bluish coloration of the affected tissue due to accumulation of deoxygenated blood. When venous outflow is obstructed by clotting or disruption of veins, venous pressure increases that lead to blood come out of the vein. As we can see in this picture, the normal state of blood flow through arteriole, capillary bed, and venule. But in the case of congestion, there is impaired venous outflow that leads to accumulation of deoxygenated blood, which is called cyanosis. We will divide congestion into types: localized, acute or chronic, generalized, acute or chronic. Chronic is more common, so it's known as chronic venous congestion. Local venous congestion. First one, acute venous congestion. Sudden occlusion of a vein by thrombus, ligature, or strangulation. Affects edema and hemorrhage. Second, chronic venous congestion. Gradual and incomplete venous obstruction resulting from pressure by tumor, enlarged lymph node, pregnant uterus, or liver cirrhosis. General venous congestion. First one, acute general venous congestion. Causes: acute heart failure, effects: rapid generalized congestion of organs and generalized edema. Second, chronic general venous congestion. Gradual venous congestion affecting the whole venous system causes. It's caused by right ventricular heart failure due to chronic obstructive lesions affecting the heart, the pulmonary vessels, and the lung. General effects of venous congestion. Hypoxia, due to reduction in oxygenation of the blood as a result of stasis. Cyanosis, due to slow blood flow and an increase in the blood volume with an increased amount of reduced hemoglobin in the distended venules, leading to generalized blue coloration. Edema, due to overfilling of venules causing increased hydrostatic pressure. Venous congestion of the kidney causing retention of water and electrolytes. Edema, start independent parts where the venous pressure is greater, especially around the ankle, and then spreads upward. Thanks for your attention. My colleague Ghasaq will complete the topic and give examples of general venous congestion.
Hello again. Here is a schematic representation of mechanisms involved in chronic venous congestion of different organs. Usually, the fluid accumulates upstream to the specific chamber of the heart, which is initially affected. For example, in left-sided heart failure, pulmonary congestion results, whereas right-sided heart failure, systemic venous congestion results. Here, we will focus on lung and liver congestion. Chronic venous congestion of lung. The most common mechanism for that is left-sided heart failure, especially a rheumatoid mitral stenosis, so that there is consequent venous pressure. Grossly, the lungs are heavy and firm in consistency. The section surface is dark and rusty brown in color, referred to as brown induration of the lungs. Histology of chronic venous congestion of lung. Alveolar septa are widened due to interstitial edema, as well as due to dilated and congested capillaries. Septa mildly thickened due to slight increase in fibrous connective tissue. Minute intraalveolar hemorrhages can be seen due to rupture of dilated and congested capillaries. The breakdown of erythrocytes liberates hemosiderin pigment, which is taken up by alveolar macrophages. As we can see in the picture on the right, here we have congested capillaries in the alveolar septa. And this is a thickened alveolar septa due to increased fibrous connective tissue. And this is alveoli containing hemosiderin-laden macrophages. Chronic venous congestion of liver. It mainly occurs due to right heart failure and sometimes due to occlusion of inferior vena cava and hepatic vein. Grossly, the liver is enlarged and the capsule is tense. Cut surface shows characteristic red and yellow mottled appearance, mainly due to congested center of lobules and fatty peripheral zone respectively. Microscopically, the changes of passive congestion are more marked in the central lobular zone, which is farthest from blood supply, and thus bears the brunt of hypoxia the most. In this picture, we can see the central lobular zone shows marked degeneration and necrosis of hepatocytes, accompanied by hemorrhage. Thank you for your time.